All right. Well, good afternoon, good evening, and good morning somewhere out there in the world. This is our wonderful, great podcast, and it's just been great to be
Oh
here.
my God, it's been a minute.
Right? The face of a hero. And of course, we bring it to you here on whatever our ways to watch this show.
We bring it here to you on Thursdays on Facebook, on YouTube, and also on thefaceofahero.com, our website.
That's right. And we're going to ask you to subscribe to our YouTube channel. I'm trying to talk Spanish here about that. On the channel, as well as following us on our Facebook page. Go and like our Facebook page.
Yes, and
yes, and soon we're going to be working on some new things. And
definitely.
Agustin is going to find out soon what I'm talking about. But we're going to, as technology improves, so are we. Right?
That's
but I
right.
think that the most important thing that we bring is the content.
That's
our,
right.
our wonderful guest. And let's just do a little short recap of what do you think about the RN, Sandra? Oh my
God, yes. We need to have her on.
We're going to bring her back. And I hope that you guys really enjoyed it. But more than anything, I hope it really touched your heart, because I was over here getting teary-eyed and, we got the tissue box just in case.
That's right.
But the things that they have to go through, I mean, could you imagine a day like that if you did not hear her speaking it?
I couldn't imagine a half an hour, like her first half hour.
I know. The first half hour of her just telling us, walk us by what does your day look like? Just walk us through it. And I was like overwhelmed.
Yes, but we're going to actually hear more. We have our special guest here.
We have a wonderful special guest that drove all the way from Indiana, and we want to thank him for taking the time and coming out here, making the time to be here, because he is another face of a hero, and he is a first responder. He is someone that you need to know. And more than anything is the heart that he has. And I have had the privilege and the honor to know him on a first basis. And so to me, it's great knowing that I can consider him as a friend, and that he's here to tell our audience the things that he does and why he does what he does, right? Yeah. So Dr. Sudhish Chandra.
That's right.
Yes, welcome to the Face of a Hero.
Welcome, doctor.
Yes, so it's
Thank
been
you
great
so
to
much
have you
for having me.
So I know who you are, but our audience, our viewers, do not know. Tell us a little bit about yourself, where you're coming from. I know you're not from the U.S. of A. A ver, tell us.
Oh, maybe I have to start from the real back, actually.
Yeah, we're going to take you back to your old days, back in the day, in your country.
So again, my name is Dr. Sudhish Chandra, and I'm a neonatologist. Neonatologist is the person who takes care of small premature babies. And my medical journey started in 1983 when I did my medical school from Delhi. That is the capital of India. After finishing my medical school, I did my residency in pediatrics, which is becoming a child specialist back home. Then for a better professional career, I decided to move with family here to United States. Then we ended up in New York. I did my residency from Maimonides Medical Center, and it was a great time, and I really learned quite a bit at that time. And after that, I decided to go to neonatology, and I did my fellowship in neonatology at Stony Brook Medical Center, which is in Long Island. And again, we lived very next to Hampton, felt very rich that we are already kind of right there where all the rich people go and have vacations.
That's right.
Okay.
But for us, that was a very busy time, because doing the fellowship and all those things, it's just involves a lot of time, commitment, and a lot of studying, taking boards and all those kind of things.
That's a lot of work.
That is actually
Many
a lot
years.
of work. So it took, I did 2 residency. One was 3 years back home, 3 years here, and then 3 years of fellowship. So at least 10 years of clinical training after finishing my medical school. And then we were looking for jobs. And the jobs are like you have to match with your family and all those things. At that time, my wife, her name is Dr. Rashmi Agarwal, she was doing her pediatric residency in New York itself, in Brooklyn. And then I got a job in Cleveland. And that was my dream job, I must say that, because that hospital is Rainbow Babies and Children's Hospital. That is ranked number 1 for neonatology for many, many years. 1, 2, 1, 2, that kind of ranking for that. So that was my dream job. So I had to move to Cleveland.
Oh, wow.
So we.
And how did the wife feel about that?
She felt okay. She did not wanted to leave that residency, to be honest. But we were lucky enough to find a second year spot in Akron. So we lived in Akron. I worked at Rainbow Babies and Children's for 3 years as an attending, and she finished her residency there. And then we moved to Schererville, Indiana, and I worked at Hammond for 6 years. Then we opened a level 3 NICU at St. Anthony in Crown Point. I was there for good 5-6 years, and for last 5 years I'm at St. Mary Medical Center as the director of NICU there, which is a level 2 NICU. And since 2017 I'm there.
Wow. So what's the difference between a level 1 and level 2?
So the NICUs are divided into level 1, 2, 3, and 4 actually. More the number is, more acute and more pathology we see. For level 2, we can only have the babies who are 1,500 grams or above, or 32 weeks or above.
Oh, wow.
But for the level 3, we can keep any baby there. Means 23 weeks and above, and 500 grams and above. And for level 4, they typically have more facilities like cardiac surgeries and all those kind of things. So that becomes level 4.
More intense.
Very intense.
Wow.
So that is the Makkah for neonatology will be level 4.
Wow. I mean, those are tiny. You said grams.
Yes.
What's the size, the smallest baby that you've had there?
Yes, obviously during fellowship, we had quite a few babies who were 500, 600 grams. And when I was taking care of level 3, we had baby which was, I think she was 490 grams at birth. And then all the babies actually lose weight initially.
Yeah.
So she went down to 396 grams, and I think that was 13 ounces. And actually, I took a picture.
Wow.
I can find that picture somewhere.
So what's the size
so
of that
It's
baby?
really just like a palm, size of a palm.
Just the palm,
Yes.
not the
And-
fingers.
Just the palm.
That's like a little puppy.
My
Yes.
gosh. Wow.
And she actually survived.
Oh, well, amen to
And
that.
Yes. So she survived.
Wow. Always.
So those are a lot of good.
So
Very
have you
delicate.
have you kept in contact with some of these babies that were that young, or do they come back and?
Yes, we actually regularly used to have something called reunion.
Okay.
And
nice.
every year we will have reunion, and I have definitely seen those babies come at reunion after 2 years, and they are actually running around. And to be honest, that is the most fulfilling
Oh my God!
experience you can actually have.
Wow.
You can actually ever have in my profession, I think. And for me, that was the most satisfying.
I would think so.
Yes,
I would
so-
think so, because here
And
you
those kids are pulling your pants on, your scrub suits, and that is so darn cute.
Wow. I mean, I know doctors aren't supposed to attach themselves to babies, but sometimes you can't help the other way around. The
We
baby's
do
attaching themselves to you.
We do attach, and I sometimes
Wow.
joke to parents that if you're missing this baby, find in my pocket. It's probably going with me
Oh my
at home.
gosh. Wait. To hear you say, find in my pocket. That is
Yes,
really
yes,
tiny, a little
yes.
bundle of
oh
joy.
my God! I'm just.
Yeah.
Oh my goodness, right?
That is very true. They're really small. And the other thing is because these babies many times spend months in the NICU.
Yes.
So
Yeah.
it becomes a family. It really
Yes.
does become like a family. And it is almost like a roller coaster ride.
Good.
So
Yeah.
these babies, some days are good, some days are not so good. So you learn how to cry with the family.
Yes.
And it has happened not once, many times with me, that we cried with the parents. And
Wow. And we do want to get to some of those stories of those patients, those babies, but something had to happen personally to get you to become a neonatologist, if in fact it did. Can you tell us, share it with us?
yeah, sure. And that may be more emotional story for me than not. And it was, I had already finished my MD back home. My older son, who is now 27 years old, he was born in December of 94. And day 3 of life, he started having some kind of abnormal movements. So we thought maybe he's having little seizures or something, and seizures in that age, they are never good. They always tend to have poor prognosis. So we take him to the hospital where I did my residency. That gave me a privilege to stay with him 24/7, because otherwise, if you're from outside, you cannot stay with them.
Right,
Just
right,
because
right.
I had done my residency from there, I was allowed to. And at 2 a.m., his oxygen kind of starts to go down. I said, oh, nothing. Maybe he's moving. Maybe that's why it is happening. But it kept happening. So we actually had to put him on antibiotics, kind of threw a kitchen sink at him, did a lumbar puncture and all those kind of things. And he almost, that's not a good word, but he almost died.
Wow.
And his leg was all black from knee down, both sides. His tip of the hands were black. That's called purpura fulminans. And his things are still crooked a little bit on the
Right,
tip.
right.
On the tip a little bit. His legs still have extensive scar from that.
Wow, that is so sad.
So,
That is so sad.
and I believe personally that he is alive because I was a physician and we were able to catch it early and were able to do what we needed to do.
And you were
And then-
present to
Yes,
see all
so-
that.
And that's why I decided to do neonatology, because it's so near and dear to my heart.
Right, right.
And many times I feel I can connect with those parents more effectively, so to speak.
Because you can relate.
Yes, you can relate, and I think no matter what, as a human, you can see that connection. You can see that empathy, because I think that comes natural because of that experience.
Right, right.
When I'm talking to those parents, and sometimes in a situation where it can be very serious, that empathy comes, and I think that parents do see that.
Yeah.
Wow. And it takes a big heart. And you personally have experienced that. You know where things are coming from.
And then how bad they can become,
Right, right.
and how quickly.
And you already being in that medical field where the parents are not.
Yes,
You can understand that better. So what was the cause of the darkness of his fingers and
So
his
that was an
feet,
extensive
legs?
infection.
Oh, wow.
So he developed a bacterial infection, and that bacterial infection spread it so fast.
Ooh.
In a couple of days, everything was kind of turning kind of black. And
Wow.
at that time, we were even thinking maybe he will need some skin grafting or something, because that was so
my God.
extensive
Wow.
at that time. But again, the good thing about babies is they are resilient. Once they start
Yes.
making a turn towards better,
Yes.
they get better quickly. At the same time, if they take turn towards worse, they get bad quickly. So
Wow.
that's the thing with the babies. So that's what the infection was, and then we were able to control it, thankfully. It was a hard road ahead, but it became better. It became better.
27 years later.
Yes, and he's a physician now.
Wow.
And he just got his residency. Just he matched.
Congratulations.
Yes, so
Oh,
he
good.
matched into internal medicine. That's what he
Wonderful.
wants to do, and then he wants to become a gastroenterologist, hopefully,
Ah,
after that. So,
a GI doctor.
And yes, he will. And yes, he will.
yes,
Wow,
if
he
stays
follows the parents' footsteps. I know he will.
Hopefully, hopefully. And again, I always tell them, just stay humble.
Yes.
Just stay humble.
That I do admire, and I see that of you.
Yeah, because,
Dr. Chandra, is the
oh,
humility.
thank you.
I do.
Because if you have to be a physician, you really have to be empathetic. It's not about, some people think that the physicians are after money. I can tell you with my experience and talking to other physicians, almost 99% of the physicians, we are not after money.
You got to
really
have a
are.
heart to see
You
the
know,
things
believe
that
me.
you see.
Yes.
You know,
99% they are not after money.
and now I know with technology is so advanced now babies, I think the rate of death has decreased from
Yeah,
preemies,
it has
right?
tremendously has decreased. So and I know you were saying about your son born at 34 weeks, and I'm sure he did have a little bit of challenge at that time. So the neonatology is pretty reasonably new as a specialty. In mid-60s, so the president, who was the president, the youngest president, come on,
Clinton? I mean Clinton.
Oh,
No,
Kennedy.
Kennedy.
yes,
Kennedy.
thank
Robert
you.
F. Kennedy. I'm saying
So-
Clinton. Hello.
So Robert Kennedy had
Yes.
a baby at around 34 weeks,
Wow.
same as your son, and that baby did not make it.
Wow.
That was the time the political will came in, and the neonatology became a real specialty. And at that time, and I remember when I was back home and I did my residency 89 to 92, at that time, even 1,000-gram baby, like 2.5 pounder baby, was a challenge to manage. Now, if it is a pounder baby, I don't even sweat. Okay,
You're kidding me.
Wow. I would.
Yeah.
We're talking grams. And I'm like,
Yeah, so
wow.
so 2-pound baby, 90% of the neonatal, or more than almost all, we don't sweat much about that
Wow.
nowadays. Doesn't mean they don't have to be taken care of.
Correct.
Doesn't mean they have
Yes.
problems.
Yes.
Doesn't mean they need like parental nutrition. They need ventilator support and all those things. But we have come to a place where 1,000-gram babies, almost 90+% will make it.
Wow. Yeah, I mean, I think we both, all three of us have something in common with
Yes.
with the neonatal, the neonatology department and the hospital where my daughter was born in. It was a great neonatal department and community hospital in Munster. And so she was actually going to be born at 5 months, but I had to do bed rest.
Bed rest, yes.
2 full months, and she was still born a preemie. We couldn't hold it as
That's right.
long as it needed to be. And so I saw parents really very concerned for their 1 pound, 2 pound
yes.
babies. This is the 99. So technology wasn't as
yes,
advanced as it is
yes,
now. So the survival rate then was not as high
As
as it
good
is
as-
now,
yes,
right?
yes,
And so you're dealing with machines, you're dealing with beeping, and then you got people running, and
Yes.
the
yes.
nurses
And then you
running.
don't know what is going on.
Right, and then
scared.
I'm the parents. We're all like a family, and you're
Yes,
correct.
it
We were
becomes a
like a family. I was there for 2 weeks or 3 weeks. Every day we go in because we couldn't stay,
That's right.
and all the moms knew each other,
Yes.
right? So we were all there for one common thing, and that was our babies. And
That's
so
right.
some didn't make it, some did, and so I got to see how the families were. Of course, you get attached; it's your baby,
It
right?
is.
And you can't help but to, and it's gonna hurt. But it's like wow. And I said, well, mine has minor issues compared to these
That
1
is
pounders,
correct.
2
That is
pounders.
correct.
She
That
was
is
born 4
correct.
pounds 7 ounces, and she went down to 4 or 5.
Yeah.
Little tiny thing, but not as tiny as the grams
That's
that you're
right.
talking about. I was like, whew, I wouldn't know how to even want to hold a baby that small.
That is true, and sometimes and that's funny though. The mothers, they will tend to hold the babies, and the dads, they keep going backwards and backwards. If you tell them, they're taking one step back, and then 2 step back, and then 3
Like,
step
how do
back.
you hold the baby?
So,
Oh no, I'm fine. I don't need to hold it today. I'm fine.
Not today.
so you have a baby that's small. How difficult is it to care for a baby like that? I mean, especially if it has a heart problem or something. I mean, it's almost like you have to put them under a microscope or.
Yes, and then obviously I'm not a cardiac surgeon, but the thing is, in the premature babies, the chance of heart disease is exactly the same as in full-term baby. Let's say the full-term baby, we have 2% chance of having a congenital heart disease, which needs surgery. The premature baby has the same. On top of it, more smaller the baby is, they have something called PDA. You know, when we are inside the mom's womb, we are connected in a different way. All those channels needs to close. But sometimes, smaller the baby, they don't have effective mechanisms to close those things.
Wow.
So sometimes we try to close them with medication. It's called PDA. And if it doesn't work, I'll say almost 30% of the babies, around 500 to 700 grams baby, will need surgery. Actually, they have to go in there and clip those. And that has to happen at that age. Means around 600, 700 grams, that has to happen.
Wow.
So those surgeons
Yes.
do a phenomenal job of doing those
definitely.
things.
Well, yeah, if the survival rate is increasing, I know they're doing
Yes,
phenomenal.
They have to clip and this thing. So even for a neonatologist, there's been numerous occasions we have to put chest tubes in. 600-gram baby, chest tubes. You can understand how big the chest is, and the chest tube is almost
Probably
this thick.
bigger than the baby.
Almost this thick, the plastic, and we have to go in the chest. So, and I remember one time, there were triplets, and then if they are
Triplets.
listening, they might remember that. I don't remember the name of those triplets, but there was one triplet, this younger one, in the night, I had to put 3 chest tubes in one side.
Oh,
She made it, everything was fine, and we were in contact
so those
afterwards.
tubes look a
and they
lot
were-
bigger than the baby.
Yeah.
Oh my
they were.
God.
And they are attached to the whole big contraption.
Yeah.
So,
It's
and it is not
as,
uncommon.
Almost as big as their forearm.
Yeah, the tube is almost this thick, a little bit smaller than that, but almost this thick, which goes into their lungs. Not uncommon.
So these babies obviously are put to sleep, right? They're sedated.
They're sedated, not put to sleep,
Or just
because
sedated?
you typically don't have time to really sedate and give anesthesia, because the putting the chest tube and things, they are more emergency situations.
right.
So we do tend to give them some morphine or fentanyl or something, minuscule amount. So we do everything what we'll do for adult.
Right,
They get
right.
morphine, they get fentanyl, they get paralyzing agents. We do everything. What
And little tiny bodies can sustain all that?
it is proportionate.
Well, yeah. I
The
mean, you're not gonna
doses
give a
we
big
give,
dose, but
doses,
still, though.
doses,
right?
yeah.
I mean,
I
And
know.
you'll be surprised how these babies can really tolerate those things.
Wow.
And it's not uncommon. Let's say you said 99. In 99, the lung disease was a big deal. The smaller the babies were, they were on ventilator for months.
yeah.
So if they are on ventilator for months, what will happen to the lung? We are beating them silly.
Yeah.
So they will become more and more chronically inflamed. That we used to call chronic lung disease. And almost all the babies who are in that range, they will have chronic lung disease. Now, much less. And then say, why it is much less now? Before that, the mothers, nowadays, we give mothers a shot of steroids before the babies are born.
Yeah, I got those. They were very painful.
Yeah,
I got
if you
those
give
shots.
them before, that has decreased the chance of this respiratory distress quite significantly.
And that's
that has really
right. Yeah, they were
helped,
giving
really
me
helped.
those. They were very painful, by
Yeah,
the way.
they are, because they are larger.
Yes, those steroid shots, but that's to help. It was they
Develop the
said,
lungs,
to
yes.
develop the lungs, and she was still
yes.
born with water or fluid in
the
her lungs,
lungs.
and then she had apnea, so she would stop breathing. So they
Yep,
had to
yep,
attach her to
yep.
that machine, so it alert everybody in the whole town because it was so
Yep.
loud that when she stopped breathing, that beeping was
It's called
so
smart
loud.
monitor. Yeah, it's called smart
To
monitor.
startle her and startle everybody else.
Yep,
but
yep.
she had acid reflux. She was like the exorcist. Wow. I mean, I got my reflexes really worked out, man, just to make sure it wouldn't catch it on the carpet, the furniture,
That's
things like
right.
that. But it was a scare, even though
It
she
is
was
scary,
bigger
yes.
than most babies, not knowing that they
That
had
is
to
very
medicate
true.
her and give her more medication to continue to develop the lungs. And her skin color wasn't yet, it
Yes,
was still
yes.
more wrinkled. It wasn't fully developed.
Yes. And if you see, the younger the babies are, they are almost like grape, almost like jelly.
Yeah. Yeah.
It takes time for them to kind of get better and better and become more normal skin. Good 7 to 10 days.
No, I can't.
Wow. I'm trying to picture the baby.
I can't remember.
And then connected to all these machines.
92 when my son was born, but I know that he had jaundice at the time, and
Yeah.
and he was in an incubator for
That's
Right,
right.
right.
for some time in there. But thank God that
It all worked out.
Our kids
Right.
made it.
Hey,
I
my
know.
daughter used to
It's
cry and throw
scary-
up.
Scary time at that time.
Well, that's
poor
true. It's
Tom.
very scary. But at the same time, I will say that neonatology has come a long way. And
Yes.
now we are in itself a big specialty. And I think we do a very good job, even though there's not always a happy ending. There's
Right,
no doubt.
right.
But at almost good times, it is a happy ending, actually.
And let me kick it up a notch with thank goodness for technology, and now these babies are making it. But now more and more, as we're going to get into it in a little bit later, about cocaine babies.
Yes.
The
Opioid
babies.
cocaine,
I mean,
Methadone,
Methadone.
Suboxone, all those things. Yeah, it is a pandemic right now.
yes, it is.
It really
It's-
is a pandemic.
So how do you handle that now that it's a pandemic and you know where these babies are coming from
Like crack-
right off the bat? Crack
crack
babies,
babies.
right?
That's
That they
right.
call them. How do you handle that, doctor? Since you have such a big heart and you have the empathy for
That's true.
families.
So one part is being a neonatologist, how you handle the actual baby. That's one thing. And the second thing is how we all collectively as a community handle the whole menace of this thing. And I remember Union of Address, and President Biden was even referring to the whole opioid epidemic, so you can understand how important it is for all of us to come together and do that.
Correct.
So I think this has two parts to it. So as a physician, when we have a baby, we kind of monitor them for something called withdrawal. And what that withdrawal is, we have almost 10, 15 signs which we look for and score for them. And that will be for, like, example, how much the tone is. They are very stiff. How agitated they are. That's the other one. How many times they are sneezing. There's many times they constantly sneeze.
Wow.
How if you pull the baby up, the head goes back. In these babies, the head doesn't stay back; it just comes with the baby. They are like almost like a board. You can pick the babies up almost like that. They are constantly crying. They have all the kind of little rash. They will have diarrhea. They have
poor
like
babies.
significant diaper rashes and stuff like that. So once they have these signs, we have to put them on medication. Typically, there can be different medication, but most commonly used medication is morphine. You give morphine, but it's a tiny dose. But that helps quite a bit, actually. It will be like 0.4 milligrams every 4 hours, 0.2 milligram. You can understand how small the dose is, but for that baby's size, that's a significant dose. Nowadays, more and more push is towards non-pharmacological. Means if we can hold the baby and calm the baby down, that is better to cut down on the medication. And that's what we are trying to go towards more and more and more and more.
Yeah, because I mean, wouldn't you? They're already coming from an addict, and you're giving them more drugs.
That is true, and that's a fine balance. But at the same time, you do not want them to suffer.
Right. Right.
And my argument is almost like if the mother, if let's say she withdraws from it, immediately what she does, she goes to the clinic, she finds another resources to get that craving down and get rid of that withdrawal symptoms she is having. So we cannot have baby suffer too. We try to use such a minimal dose so that it just takes that edge off the baby. It kinds of helps out, and that controlled way we can remove it or take it away. So in few days to weeks, we are able to be without the medication, and the baby does very well.
So now some of these babies, are they born less weight when they're born?
Yes, yes.
So
yes.
they're born less weight, they're born with possibly
Yes,
more
yes.
problems?
Some abnormalities.
Yes, more problems.
Addicted.
They are very difficult to gain weight on because their metabolism is already so high. They are so hard to gain weight, even though you'll say, wow, you're eating good. And even then, they are not gaining weight because their metabolism is so high. They are having constant, lot of time, they have a lot of diarrhea and all those kind of things. So it's not an easy thing. And they are, and this, once let's say the baby went home, even then, for a few months, they'll be more irritable. They'll be a little bit more harder to take care of than a normal baby will be. So sometimes the child abuse and all those kind of things. And the whole scenario, if you see, is like that. They're probably not a stable home.
Right,
Not always, but more chances of being in more trouble. So there's a chance of baby getting into trouble of child abuse and all those kind of things.
I have a friend that adopted 2 children that were
Drug.
drug babies, and then I'm going to call them, for lack of a better term, but drug babies, and he was having issues with them, irritable and everything,
Yes,
and
yes.
now they're, I can't remember how old they are, but now they're starting to calm down a little bit, but he still has difficulty with them.
And there's no knowing how long that lasts.
Yeah.
There's no knowing how long that lasts, how much permanent damage it causes. God only knows, that kind of a thing.
Wow. So that's more devastation added on to your
normal-
care for a baby.
Yes. And it's not uncommon. They sometimes stay 3 weeks to have a baby who stayed there for 2 months because could not withdraw from that
Wow.
medication. Sometimes it takes that long for them to stay in the NICU or under special care nursery.
And does that depend on how
High the dose was, how high the dose was,
long the mom has
and
been?
how long the mom was on that drug.
Okay.
Wow. So let's take a scenario, if you will, Dr. Chandra. For those of you that are just chiming in, this is The Face of a Hero. We have Dr. Sudhish Chandra. He's a neonatologist in Indiana and has a heart for our babies.
That's true.
And kudos to your wife as well, because she too deals with babies,
Yeah,
right?
babies and children, yes.
And children as a pediatrician. So a child that comes in or is born preemie and is a drug baby, as Dean said, for lack of a better term, what's the worst that you, as a person, as a human being, because you have empathy for them, because you've been there with your child, that you've gone home with that in your mind and in your heart? I mean, do you go home with that? And how do you handle that?
And no matter how,
or any preemie that
that's
matter,
right, and
crack or not.
no matter how
cocaine.
professionally you try to detach yourself, because after all, at some point you cannot be taking every time home. But
Right.
no matter what, there are things which you will take home because there were certain things unexpected. And one baby, and I don't know if the mother will remember, I hope she don't feel bad, but there's no names. So this baby was a premature baby, and precious baby means every baby is precious, don't get me
Course,
wrong, but this was a wanted baby, like they really wanted to have this baby. Baby is 32 weeks, has regular problem with like 32 weeks, and the heart, the arch, supposed to be on the left side. This baby's aortic arch, the one main arch, was coming from the right side. So when it is a little lopsided, you want to make sure that there is no other heart issues, because if the wiring is wrong in one side, maybe the wiring is wrong in the other side too. So we did an echocardiogram. They had an echocardiogram during pregnancy too. Nothing was found. But pregnancy is pregnancy because you cannot get a clear picture.
Right.
So once the baby is out, so they found one of the artery was coming from the abnormal side. And I said, no, that won't be a problem. Let's transfer the baby. We transfer the baby to a different institution for the surgery, and baby did have to have a surgery because that was the kind of thing. And even with that simple surgery, baby ended up losing the life. And that was so profound on me. Believe me, it really was very profound. I'm like, how, I said, how cruel God can be, you know what I mean? Because this was like a regular kind of a surgery, and we do so complex surgeries these days. So sometimes those are the things which will never go away from your...
So what
Wow.
is kind of like a routine surgery?
Yeah, almost routine surgery, 30, and the mom just keeps saying, oh, will my baby be okay? And I'm saying, yeah, I don't see any problem. Why? And sometimes it feels like that the mom had that intuition that something's...
Yes.
Oh my God, I just could not sleep that day.
Wow. And
Yeah,
and
those-
and I guess it takes someone like you to get used to seeing premature babies and what they look like, but I would have that engraved in my mind
I don't think you can get used to
of
it.
what a baby looks like. That makes me just want to just love on them and care so much, but I wouldn't know how.
How to take care
Right.
of those. And then, believe me or not, premature babies are more child abuse cases, just because they have become difficult to handle. Sometimes it puts financial strain on the family. Taking care of that baby is another issue. Then professional life gets affected and all those things. So it's not an easy thing to have that. So it can be a little challenging, even if it is a normal premature baby who just had a normal course and went home. Even then, it's not an easy thing. It's not an easy thing.
What sort of the things, if you know, causes to have a premature baby?
Yeah, see, that's the $1 million question. $1 million question. And see, the rate of prematurity had been very stable almost throughout, around, and I may be a little bit off, but around 7 to 8% in that range. Despite all the treatments and everything, it has not gone down. It has not gone down because we do not know what the actual cause is. Most of the time, we blame infection as the more common cause of prematurity. So whenever the baby comes out premature, we tend to put the babies on antibiotics because we want to make sure it is not infection. Sometimes, though, the uterine abnormalities, let's say the mother has 2 or 3 premature babies. Sometimes their cervix, instead of being here, sometimes it is more open. So that can be a cause for repeated premature deliveries. But I think it's more commonly infection and some abnormality of uterus and things like that. It's very difficult to decrease that rate.
Well, and if the mother is not taking care of themselves, not
That
doing the
does, yes.
prenatal care, the prenatal
Yes,
vitamins and
teen,
all that.
teen pregnancy or
pregnancy.
advanced maternal age are also kind of factor into the premature
Speaking of,
babies.
Has there been any studies on this? Or
Tons and tons of
I'm sure.
studies, tons and tons, because everybody wants to take care of those premature babies, especially if we can prolong it to more than 28 or 30 weeks. We are in good shape because most of the babies do well at that time. But we are still having babies born at 23 weeks and 500 grams. Babies are still being born. So if we can stop them somehow, we won the battle, but that has not been happening. In neonatology, we say 1 day inside is 2 days outside. Means if you can keep the baby 1 day inside, it will take away 2 days from the NICU stay.
Okay.
Wow.
So-
So you mentioned teenage pregnancies. Do you see a rise on that, doctor?
Yes, there is rise, but I think it is stabilizing, though. I think it is
Well, that's good to
stabilizing. Yeah, it is. I think stabilizing because more and more programs are kind of geared towards those things, but this lot needs to be done, and I think it's awareness. I think awareness is the
Awareness
key.
has a lot to do with it. and-
Awareness is the key. I think it's all about awareness, knowledge, knowledge, knowledge.
Absolutely. And it's interesting that you're saying knowledge, but some of the schools, the public schools, are teaching about, how can I say, about the birds and the bees.
birds and the bees. Right. I was going to say
The birds
that.
and the bees at a younger age. And I understand they want to
Educate them.
educate them, but
Yeah, you kind of open that Pandora box. God only knows if they didn't even know them. Now they're like,
Right.
that's something I can explore.
Right. Exactly.
So I think that's a fine balance, but at the same time, and again, and I'm not talking from political point of view. I'm just talking about my own thing. It still looks like knowledge is still power, because
for sure.
if they come home and the parents are talking about those things and the school is talking, because if you have knowledge, at least you know where the problem is, even though it opens that Pandora box, because they may find out 6 months later, but they're going to find that out.
Right.
So more knowledge they have, more prepared they are.
Right.
They should know what the
Right.
risk
Less
behaviors
mistakes.
are and all those kind of things.
Correct.
It seems very counterproductive, but at the same time, it has to be done.
yeah. Well, sometimes, yeah. Well, like you said, it's counterproductive. My daughter, she went to school at a public school on the near west side in Chicago here. It was 65% African American, and they were teaching this in the younger grades, and I'm like,
5th grade.
That's a bit too young. But
was
babies,
too young.
12-year-olds are having
Yeah.
oh
children.
no, absolutely, but they were. It
Yes, we had one 13-year-old.
and I guess
Yeah.
I
Maybe.
think it depends on how you present it, as opposed to trying to.
I know. I agree.
push having sex
I
at a
agree.
young
I
age.
agree. I agree.
But some of the kids that were in our 6th, 7th, and 8th grade, they were already promiscuous. So even if you're teaching them that they're already like
Engaging.
You said,
I know.
Yeah.
Yeah, engaging in those risky behaviors and stuff. And all those things, you are involved with so much of these human trafficking. We had this Asha event try to create awareness. Looks like and mental health. Everything is starting around 7th and 8th grade, looks like.
Yeah.
That
catch
is
them in
the
middle
time
school.
you can catch them. And I have a strong opinion. Once you have gone to 12th grade or to college, believe me, I don't think we can change those behaviors.
It'd be a lot harder.
That's what, or it'll be a
it
lot
would be
harder.
a lot harder
Yes.
to try to change those
Trying to
behaviors.
change. So
and
I
habits.
feel that it's kind of a fine balance, but I think we have to catch them around 7th, 8th grades.
yes, yes.
Because even with mental health, they are depressed. 7th grade, what are you depressed about?
Oh my gosh.
Oh, I know.
I went into an office to interpret, and these are twins, set of girls. Something had to happen where they had to remove the dad or what have you, and I think they lost their mom. So they're on medication, Prozac.
Yep.
They're 12 years old, and I was like, oh my
Yes,
gosh.
yes.
What do you know about depression? Why are you depressed? What are we doing about it?
Exactly.
Do some more natural things. But when you go to a psychiatrist, what do? They medicate you.
Yes, they do. They do. I agree. I agree.
And
More
those
we
has-
are, and many times, to be fair to the physician, many times the parents demand it.
yes.
it makes it easier for
It's
them
big-
to
yeah,
control
because
them.
because it looks like it's just like TV being your babysitter. So it's
Yeah.
a drug being
Yeah.
your babysitter.
Yeah, yeah.
And because
Yeah.
many times Rashmi will come home and she will be very upset because she did not write a dose medication for ADHD, or she did not increase the dose. And they come
Yeah,
after her.
yeah,
They have slammed the doors and they have called
I
her
want my medication.
different names and stuff
Oh,
like
no.
that.
Yes.
And she's a very sensitive lady. And I said, just that's okay. That's okay. That's one another day in your professional life.
Yeah, and not realizing that Dr. Rashmi is actually doing them a favor by not medicating them.
Exactly.
And then she tries to go into the detail of why and how we can probably change. And there's a limit to how much drugs you can give. Because if the diagnosis is not correct and keep giving drugs, it's not going to
Yeah,
make a
it's not
difference.
going to help. It's only going to
Make it
provoke
worse.
other things that can go
Yeah,
wrong.
I think that's why the answer is awareness, awareness,
awareness,
awareness.
awareness. And speak-
Another drug they're taking too is these sleeping pills. I forgot what it's called.
Ativan, diazepam,
Yes.
alprazolam, Ativan.
Yes. I'm hearing them talking. It's like, oh, my daughter one of her friends says that, oh, she takes this to get to sleep. And
Yeah, the 12-year-olds, the doctor's giving them sleeping pills.
it's like, what?
Yeah, exactly. So that's not normal. That's
No,
not
no.
normal.
And the parent is, because there's no knowledge, we don't know any better, so we won't do any better. And this is the grandma who's taking guardianship. What does she know?
Yep.
Oh, okay, sure.
Oh, yeah.
You feeling better? Yeah.
That's
Sometimes
it.
give them a placebo, and they're gonna
They
feel
will
better.
feel better too. Yes, exactly.
It's
Exactly.
all here.
I don't know if growing up when we were like, oh, I'm bored, Mom. I'm bored. Dad, I'm bored. Here, take this broom, go outside and
Exactly.
And their boredom is gone.
Exactly.
Exactly. Oh, I don't know what
We
to do.
had too many things to do
Yes,
outside.
Exactly. And now, and that is actually true. If you are bored, your brain is very productive at that time because you're trying to find how to get rid of that boredom and you're creative. So sometimes having your kid getting bored is important.
Yeah, stimulating.
Stimulated.
Well, as
Because-
us Christians say, an idle's mind is the devil's workshop. So
Yeah,
put it to work.
exactly.
Put it to
So they'll
work.
think of something
Yes.
and it probably will be creative. It
Yeah.
may be dangerous,
Right.
but it still be
dangerous.
creative.
Because speaking of dangerous, the first question they ask, so are you having suicidal thoughts?
Yeah, and they
Because
get
when
them
they're
into the hospital.
depressed,
Yes.
the,
And they get in the hospital.
the suicidal thoughts come into play. And have you attempted to do that? And I'm like, wow, 12 years old, such a young age.
Yes.
And some of the music that's out there.
Oh,
I think
talking
social
about-
media. But I think
And
my
social
wife
media,
thinks
oh.
my wife thinks that social media is the main culprit, in her opinion.
Yeah.
Because I keep
Yeah.
asking. And remember, I was telling you I want to start that Asha Foundation.
yes, let's talk
and
about that.
and
yeah.
so I keep asking everyone what their opinion is, what we should do, and things like that. And I was asking her, being a pediatrician and seeing these kids, which is age is becoming younger, and younger. I said, why you think that this is happening? Because when we did residency, I hardly saw one patient with depression in pediatrics, none, zero. And now it's almost half the practice is that.
Yes.
So she
I'm
said,
hearing
I
more
think
and
this
more.
is all, half of it is social
media.
media and family structure. Those are the two
definitely.
two important things. That's why creating the awareness about the social media, that if you don't get 20 likes, fine, it's not a big deal.
Why didn't they? Yeah, adults even go there. Why didn't they like it?
Yes.
They don't like me.
Yeah, so it comes down to they don't like me.
Right.
They may not like the post, or they are tired of doing likes for that
Sad. It's,
for
it's
one
sad.
person.
It's sad, but we may be laughing, but it is sad that it's happening. Suicidal rate is
Yes.
going up.
Oh, after COVID, almost 1.5 times.
Yeah.
And imagine now, I don't know if you know the stats now with the opiate overdose. There's a drug they had in 1 week,
Fentanyl.
quite a few, fentanyl. Fentanyl.
Yes, because
In Hammond, I saw
you know,
that.
You know, the fentanyl was used to anesthetize the elephants,
Oh, my goodness.
because that thing is so potent. It's very, very potent. And nowadays, this is all laced into the regular drugs and stuff like that. So most of the people are dying from fentanyl overdose.
Yes. I'm hearing it more
Lot
and more.
of overdose.
And they're giving a lot of these homeless people, you're hearing about that too, is, some of them have access to that. And the next thing you know, they're,
Yeah, because and they don't know how much control.
Right.
So I was talking to my son. I was telling him that I will bring him here, and because my heart really lies into this, then I'm not kidding. Because I really want to make a change when it comes to opioid
yes,
and this
you do.
this mental health. And we really are seriously working how to get some mentorship program, how to create this awareness, how to do those things. So I'm asking my younger son, who is at University of Chicago as a second-year medical student. I said, what about this drug? What do you think is the solution to that? May not be a complete solution. He said, you know what? Some of the countries, they have cafeterias where you can go and get an IV drug.
Oh my gosh.
But we will not do here And I said, yeah, obviously not do here. But he said that may be an answer, because if you go there, you are controlled. You get whatever high you have to get, because these people are going to do no matter what. They are going to go to safe houses, whatever they call. I don't even know what they call them, drug houses.
Yes.
So he's saying that if we do that, maybe, I don't know, maybe some of them gradually kind of wean them off from there, and that becomes more like a treatment center at that same place. And this thing, that
Instead
was
of going
revolutionary.
away somewhere else,
Instead
you're
of
doing
going
it in
into
front of someone that's supervising you.
supervising, and they know what the dose is.
Right.
It's almost like a medication,
I
don't
like
know.
doctor giving like 10 milligram. I said,
know.
that's revolutionary.
It sounds like
Because
it.
since they've opened up these dispensaries,
Yeah,
I'm seeing more and more people
Doing
and-
it.
and doing it.
I know.
And-
Now they can't be catched.
Right.
They
Yeah.
can't be caught.
So for me, it's I'm seeing it, I'm smelling it. Even my daughter, she's like, "Oh my God, that smell!" Because you're
know.
driving and it's in,
Yeah.
right in
It
front
just
of you.
whoosh, slaps you.
Yes, yes, yes,
Oh my
yes.
goodness.
I was working with a gentleman, and he might be seeing this and that, but you know, when you're working with somebody, he happened to come the day that he came, he was high, and I told him, and you can tell when somebody is high, their personality, then
Changes. Oh, absolutely.
so I said to him, "Look, the day you came to do this and that," he goes, I told him you were high. And he says, "I work better that way." I says, "You didn't."
They think that.
I
They
says,
think
"You
they're
didn't. You
alert
were-
and they know what they're
you
doing.
were off.
Have you seen the movie Flight, where Denzel Washington was prosecuted? He did everything correct, but he was high. That's why he was prosecuted. So you cannot just say high and then.
Yeah.
But it's legal now, so it's okay.
So and that's the whole thing is that I'm like,
So another story. I just had recent experience. So this mom comes in. She has seizure disorder. She's pregnant, and she was, how many weeks was she? 37, like 3 weeks early or something. And she's stopped taking medication for her seizures. She's taking marijuana for controlling seizures.
CBD or whatever.
I don't know what she was taking. So she came for a C-section. She had her marijuana, had a seizure the day prior. On the OR table, she gets her spinal and everything, and on the OR table, she has another seizure.
Oh my
Oh, wow.
goodness.
So I don't know when you will understand that if you continue to have seizures, that means whatever you are doing is not working.
Right, right.
You know what I mean?
Yeah.
So, and I saw, that is the first time I ever saw like marijuana being a sole medication for seizures, and you continue to have seizures.
She just liked the feeling.
Yeah. So that was the first time I ever saw that as a medical marijuana actually in use.
But how does that affect the baby? Won't
Oh,
it
it
affect
does.
the baby?
Oh, absolutely it does.
Medical or not?
Oh, absolutely, it does
So
affect the
pregnant
baby.
women, don't do that to your baby.
No, and and I always say that. One time I went to one of the medical school just taking the class, and I was telling them that if you can take one lesson from this lecture is never do drugs, especially when you are pregnant,
Yeah.
because
Wow.
you do not know how much permanent effects, if not damage,
Damage, yeah.
effects
Yes.
you are causing to that baby. Baby will be 40 years old and say like, I can't do 2 + 2. Oh, maybe because of that marijuana my mom was smoking.
Wow.
You know what I mean? God only knows.
And now with the crisis with the opioid overdose and fentanyl and all that, I want to bring it to our audience. The great thing that you're doing, you start out with your community, the Indian community, but
That's
you've
right.
opened up doors to the whole community. But this is bringing awareness to your
Yes,
community first and foremost, because
everyone else.
and you're inviting the community to say, hey, look at what's happening. Now, the one that you did last year, I will say, obviously with the panelists that we have, changes the dynamic, changes
Yes.
the story, changes the experiences. And this last time you had a doctor and someone actually where can actually prosecute the doctors
Yes,
that are
yeah.
prescribing opiate.
Yeah, we had a prosecutor there, you're right.
Yeah, the prosecutor was there, and older people are getting addicted to this drug, so they're dying of overdose
Yes.
because they're in pain, and these are prescribed medications. And now they're to the point where, because we know some doctors, because I know one personally, that all he was doing was Xanax, here's your script,
Yep,
Xanax. My dad would show up at his
absolutely.
office upset and angry. I want my Xanax. I need it. Look at me. I'm like, you're addicted to it now, Dad.
know.
Yeah.
And he would demand it, and the doctor was like, there you go. I had to fire the doctor.
Yeah,
I'm like, no, we got to wean you off of
yes,
this.
yeah, you really have
And he got
to.
mad. He was angry because he wanted it. And I knew that he was getting addicted to it. But now, well, you can prosecute the doctors that do
Absolutely.
that. So I was
Absolutely.
glad to have heard that.
And there are a lot of changes also made in the regulations. So how much medication you can prescribe. You cannot give more than a week. You cannot give this. You cannot give that. So that has brought down. Before that, you'll get 60 tablets, just like you prescribe, and you get 60 tablets.
Yeah.
So what do you do with the rest of
And
them
then
when
if
you
you
don't
lose the
use them?
prescription,
And then-
so they say they lost it.
They sell them.
Yeah, they sell them. So that's what it is. So I think the pendulum is swinging towards the right way. I hope it doesn't go all the way down, because sometimes it affects the people who actually really need it. Because there are people who have cancer, who have really
Yeah,
back pain
yeah.
issues and stuff like that,
Yeah.
who need that medication.
Yeah.
And at some point, the pain was made a sign, like a vital sign. Nobody was supposed to have pain. And that's how that prescription kind of went higher and higher, because the doctor didn't want their patients to be in pain, because that's how they were being evaluated.
Yeah.
So,
So thank you for that awareness that you're bringing with ASHA, and we just have just a few minutes left. If you
Yes.
can tell our audience, what is ASHA, what is that all about, and why you do what you do with that?
and again, everything has a reason. And I had some of my colleagues who lost their kids to suicide and drug overdose. And obviously that personally affected me quite a bit, because those kids were my kids' age and things like that. So I wanted to create awareness about the opioid and the mental health, but I wanted to do in a fun way, because I realized there are so many resources out there. There is no dearth of resources. But those resources are not connected to the community. Community doesn't know where those resources are.
right.
That's right.
So my purpose was hopefully to marry that resources out here and tell the community, see, here are the resources, you can do that. So we made it more like a fun event for good 6-7 hours. We had more like a fair. So we brought musical, we got the full band. We had her covering live. We had a kids fair where we had balloon twisters and face painting and all those kind of things. We had almost 8 or 9 baskets to raffle. So those were the kind of things we tried to bring, so that people can talk about this thing in the friendly environment where kids are welcomed.
Yeah.
And I'm sure you are testimony to that. We had almost 60 kids that day,
Yeah.
and that was so
Yeah.
fulfilling.
It was.
Yeah.
And thank you to the Lake County Sheriff, the
Yeah, he was there.
helicopters there, and their vehicle, the bulletproof
Yes.
vehicle that looks like a Humvee, whatever, there, so that the kids can take pictures with it and see what they look like in real life, other than seeing it fly above in the sky.
And
It there.
Oscar was great. He was my first sponsor.
Yeah.
He said, "I'm with you."
Yeah.
So the whole Lake County Sheriff Department was right there, and I can not say enough about him being there.
Yeah, yeah.
So-
And the Lake County prosecutor, we had doctors as panelists. I mean, it was
We
just
had coroner,
the coroner was there, a doctor.
judge, psychologist.
Yes. So we
Oh, wow.
covered all the
So we had
spectrums of people that need to be there to hear the stories about families. And we opened the floor for people to get on the mic and talk about their stories.
Personal stories.
Personal stories. They got on the mic, they got on stage to talk about how they lost their child to suicide or to drug overdose.
Yes.
This is real, this is happening, and families need to be aware.
That's
Right.
correct.
And where to
this
go
was,
to.
But for so many of them, this was the first time they could ever open up. And all of them were so thankful that they got a platform and their burden was a little less
Yeah.
because
yeah.
of that.
Yeah, just getting it
So-
off their chest and knowing that they're not the only ones that
Mm-hmm.
that's going through that. This is real.
And then we want to continue that. And I'm
Yes.
telling you, we are going to continue that too. We are going to call it ASHA. And ASHA stands for awareness, S for support, H for help, and A for action. And in Hindi, it means hope.
ASHA
And that's what
means
we are
hope.
trying to bring. ASHA means hope in Hindi.
Okay.
So that's what it stands for. And that's what we are hoping that we can continue and come up with some innovative ideas with
Thank
her and
you.
obviously with
Yeah.
everyone's support, because
Yeah.
we as a community, we just have to do something.
Yeah.
Oh, absolutely.
I mean, and there's not a dry eye in that whole facility.
It was not, yes.
And at the end, I love it. Trying to remember her name.
Vigil.
The candle.
Sheila. Yeah,
Sheila?
Sheila
Sheila.
Conda did the vigil.
Kudos to Sheila.
Beautiful.
We do a candle vigil. Well, they put the light in a bag and they go out on the stage. All the youth that's part of this. And this young man, I will say, can really get the youth involved.
We did have a lot of youth, yes.
Yes, you did. And kudos to
Yes,
you and your
absolutely.
committee. And
Yeah.
I just am thankful to hear that you're going to continue it.
We are gonna
And I will
continue
continue
it.
to be part of it and do whatever I can on my part to
Anything
let
that
Peter
we can
beautiful
do
to do
here
it.
ourselves
Yes,
here,
absolutely.
promote
And
it.
we will promote and we will try to do more places.
Yes.
And my vision is at some point we can get one day where these events can be done nationally.
Across the country.
Across the country, the same
So we
day.
all
just like
celebrate it.
Yeah, just
Yeah.
like police, what do you call it? Police night out?
The police night out.
So something like that. Police night out has a one day in the
Where
year.
all different cities are doing
so
it.
all different city, we can have the same event everywhere.
Yeah, that would be nice.
And
So-
that will create that awareness like this.
Oh, yeah,
And,
definitely.
and speaking of Asha, how can we find out more about it,
Yes.
Dr. Chandra, or besides through me, through us? But
Yes, and I'm working on it because.
so
I have
stay
to-
tuned for that
Yes,
information.
and we will have a website, we will have a non-profit, we will have everything, and mentorship program or something like that. And our plan is hopefully involve that again, 6th to 7th grader, where we can have 10th, 12th grader become our mentor
Their
and teach
mentor,
those kids, and they can get a certificate or something which can be used for getting their college admissions and stuff
Right,
like that. So
right.
we are going to make it a formal program kind of a thing
Yeah.
where they can achieve and they can help out the younger kids, because if I go and tell those kids, they're not going to listen. So we have to go by kids for the kids. That's the only way to.
we need youth ambassadors.
Yes,
Yes,
that's exactly.
definitely.
And we will call them youth ambassadors, mentor.
And speaking of youth, I want to let our audience know something that was, to me, great to see is that he's bringing kids from doctors, from professionals to come and feed the homeless.
Yes.
That's an experience for these kids.
Absolutely.
And keep them humble, as he said.
That is
Keep 'em
true.
humble.
Keep them humble. We interviewed
Yes.
them on the radio about how great they felt to put a basket
Yes.
together, to buy gifts for them, whether it's some socks,
Yeah.
some shoes, or T-shirt, or pants.
one of the
We
things that
we took them inside.
The
See, there's a
shelters.
brother keepers shelter,
My brother's
and that
keepers.
broke my heart. I'll be very honest, and I still speak with IGKN, and I tell him that the beds didn't have sheets, so they were I think 20 beds or something. So we bought 20 sheets, not a big deal, but I gave to each and every kid. One kid was supposed to go and put by themselves on the bed. Not just we gave 20.
Right. And that just showed them how blessed they have been,
Yes.
that they don't have to ever worry about.
Blessed is right.
Once they
Blessed is
went
right.
inside, they said, "Oh, there's no AC here." I said, "See, there is no AC.
No AC in that
There's only
place.
one room back there, just for like a bathroom. They don't have just have so much common bathroom for 30 people.
Right.
So they could see that, and they really were.
And I think
Really
more and more
teary.
kids, parents need to involve your kids in doing things like that so that they can realize how good they have it and not
How
complain
fortunate- how
and really
fortunate
not
they-
take
Yes,
anyone
yes.
or anything for granted. So kudos to you in doing that and
Oh,
your,
thank you,
your
thank you,
committee
thank you.
and bringing those kids to show them what reality looks like.
Reality looks like. Yes, yes.
Thank you so much. Any last
thank-
minute things you want to mention before we go?
Thank you for having me here.
Thank you. Thank you for.
And let's make a difference
For sure.
from our heart. That's what my last thing is, and take care of your kids, because I strongly believe it's almost like monkey see, monkey do. If we are good role models for our kids, we don't have to teach them anything.
That's right. That's right. It's no
Really.
more do as I say and not as I
Yes,
do.
no.
That
If
does
you
not
go
work.
like this, that's not going to
That
work.
does not work.
Yeah.
Yes.
Yeah.
Do what you can do.
And moms to be, take care of yourselves,
Yeah.
so you don't have to see this fabulous doctor here.
Right. Exactly.
You don't want.
And no offense taken. We don't
Yes.
want to see each other.
Yes.
Yes.
If we want to see him, it's not in those circumstances.
Yes.
In Asha event, that's where we
Yes,
want to see
that's
him.
what we want to see. Yes.
That's right.
Well, thank you guys for tuning in every Thursday at 8 p.m. And of course, this is The Face of a Hero with our special guest, Dr. Sudhish Chandra, a neonatologist that has a big heart for the community, and I commend you for all that you
Thank
do.
you. Thank you.
Thank you once again for coming on our show. And
Thank you, seriously. Thank you for having me here.
Yeah.
Yeah, and more guests to come, right?
Yes. And if you'd like to be on our show, reach us at 872-265-1829. Give us a call. Look for us on Facebook and also on our website, faceofahero.com, and
On our
Instagram.
YouTube. And we're going to be on Instagram. I see you. Wait, you're on Instagram, aren't you?
Yes. So
He
and-
surprised me.
And YouTube.
I need to learn that.
And also,
Instagram.
yes, we're going to teach you. And also subscribe to our YouTube channel and share the information.
Yes.
Share it.
Absolutely.
And this is for our heroes. This show is about them and for them. It has
That's
nothing to do with us. We just are
Yes,
here so
true.
that we're giving them the platform. This is their platform so that they can open up and share their story.
That's right.
About what it's like to be in their profession.
That's right.
All right. Well, until next
you
time.
again.
We'll see you Thursday at 8 p.m. for next week as well. And this is going to be an amazing year. Take care.
Absolutely.